Hi, I'm Elle, and as an intuitive wellness coach, I help women to rediscover natural energy cycles in order to manifest their best lives with ease and flow. Today, we're exploring what is lifestyle medicine. Lifestyle medicine is a medical approach that uses research based lifestyle recommendations to prevent, treat, and manage chronic disease. The six pillars of lifestyle medicine are exercise, nutrition, sleep, stress resilience, positive social connections, and the avoidance of risky substances such as alcohol and smoking. Each pillar can have an effect similar to medication that helps to relieve signs and symptoms of illness and attain an optimal state of health. Lifestyle medicine approaches are recommended as a first line therapy for many global leading causes of death, like heart disease. Lifestyle medicine interventions can prevent, treat, and even reverse some conditions, such as high blood pressure and obesity. Lifestyle based approaches to improving our health and well being are needed more than ever before. We are living in a time of misalignment with our natural rhythms, and we're in the midst of an evolutionary mismatch as our genes are being triggered like never before to try to keep up with the advancements and the stimulus all around us. In order to thrive, we must place great importance on the lifestyle tweaks that we can all make to help us cope with the societal changes we're living in. Following the industrial and digital revolutions, advances in technology, transportation, and information have had profound effects on our bodies and minds. Although many of these effects are positive and have contributed to a higher quality of life, there have been unintended consequences that have negatively impacted our well being. For example, technology has increased productivity and made transportation easier while reducing the need for physical activity. The rise of social media makes it easy to keep in touch with friends and family while also increasing social isolation. Diets that once consisted of fresh foods harvested from local farms or gardens have been replaced with prepared and highly processed foods. We must look at the quality of our lives and not just measure the number of years we live. Here are some research based recommendations for reducing a risk of chronic conditions by making lifestyle changes. Heart disease has been the leading cause of death in the US and globally, even during COVID-19. The US Health and Human Services recommends 150 minutes of moderate intensity physical activity per week, while the American Heart Association recommends an emphasis on fruit and vegetables to take up the majority of your meal, along with whole grain foods, healthy sources of protein, fish, seafood, poultry, low fat dairy, and lean meats. This falls in line with the Mediterranean diet. Also, minimize added sugars, ultra processed foods, processed meats, foods that are high in salt, and alcoholic drinks. The AHA also recommends that adults should sleep between 7 to 9 hours and explore ways to reduce stress, as this impacts the heart directly. This can include deep breathing, meditation, Tai Chi, and yoga. It was found that patients who are more socially connected live longer and with fewer complications. Without social connections, stress can be high, and people may be inclined to use risky substances such as alcohol and smoking. The AHA recommends not drinking at all or limiting alcohol use to 2 drinks per day for a man or one for a woman. Moving on to recommendations to improve diabetes. The World Health Organization recommends between 25 to 29 grams of fiber each day to prevent diabetes, stroke, heart disease, cancer, and obesity. A healthy plate for a diabetic patient should include half a plate of non starchy vegetables, a quarter plate of carbohydrates, such as whole grains and fruits, and a quarter plate of healthy proteins, such as nuts, seeds, and some fish. This doesn't have to take place in one meal. It's a guideline for the overall quantities of these dietary recommendations. So you could have a salad at one meal and some fruit or nuts as a snack later, and then fish and half a plate of vegetables for dinner, as an example. 150 minutes of moderate physical activity per week is also recommended. A recent study in the Journal of Applied Physiology demonstrated that blood glucose levels should decrease in healthy individuals if they enjoy exercise snacks throughout the day and do not spend long periods of time sitting down. This could be 5 minutes of walking or stretching or exercising, or a 15-minute exercise class like I like to do during the day. The American Diabetes Association recommends that people with diabetes or prediabetes stand and move around at least every half an hour. Also, very helpful is 7 to 9 hours of sleep per night for adults, as this will keep ghrelin levels low, which is the hormone that makes you hungry, and leptin levels high, which is the hormone that keeps you lean and makes you feel full. The American Cancer Society's recommendations for lifestyle choices to limit the development of cancer are: achieve and maintain a healthy weight, be physically active, avoid alcohol, and follow a healthy eating pattern. I like to incorporate lots of colorful vegetables such as beets, leafy greens, purple cabbage, red bell peppers, and all the colors of the rainbow each and every day. I hope these lifestyle medicine approaches and recommendations have helped to inspire you to explore the 6 pillars of lifestyle medicine. Exercise, get some movement in your day. Nutrition, eat the rainbow, incorporate lots of fresh vegetables and fruit, and avoid processed foods as much as possible. Sleep, get 7 to 9 hours a night to impact your health in extraordinary ways. Stress resilience, take time to rest, especially for women. Our hormones fluctuate and we need times to rest and restore. Maintain positive social connections with loved ones, friends, and like minded people, and avoid or limit alcohol and smoking. Wishing you the best of health always. Like and subscribe for more wellness tips.